Hi, this is Jen Kay, and I'm here at the Arizona Natural Health Center in Tempe, Arizona. I am so excited and honored to be hosting this segment of natural remedies for common and sometimes not so common conditions. Today's segment focuses on some of the common problems that come up with women during pregnancy. And today we're going to talk about some of the natural ways that you can treat these conditions using a whole person approach. I am so delighted and honored to introduce to you today Dr. Kwan, who's one of the incredibly talented physicians here at the Arizona Natural Health Center, who treats conditions like this in a very natural way. Dr. Kwan, welcome.
Thank you very much.
So, Dr. Kwan, we've known each other for some time, and I think one of the things that amazes me the most is you are a mother, correct?
I am.
And so you've done this once before.
I have done this once before.
Once before, and here we are ready to rock and roll, and we're doing
a
this
second
again.
time.
So this makes you particularly qualified. You know exactly what women are going through during pregnancy and the challenges that come up. So, Dr. Kwan, one of the common challenges that every woman experiences during pregnancy is the element of morning sickness, and yet each woman sort of experiences that differently. Can you tell us today a little bit about what morning sickness really is and what are some of the common symptoms?
Sure. Well, morning sickness, in fact, is a bit of a misnomer. The official name is nausea and vomiting of pregnancy.
Wait. Nausea and vomiting of pregnancy.
Yes.
Okay.
Correct. About 80% of the women who are pregnant end up getting some sort of nausea or vomiting. Usually during the first trimester, it starts around 4 to 6 weeks and usually ends up subsiding near the end of the first trimester around 12 to 14 weeks.
And so in that, so I know some women experience that differently, is there anything that happens? Is there something that goes beyond nausea? I mean, how do you know when it's regular nausea or something different?
There's a condition called hyperemesis gravidarum. About 1 in 200 women will get nausea and vomiting this severe, and what it is constant nausea and vomiting, which really can be very debilitating. Imagine trying to function in your everyday life and having this condition. So there are things that we can do.
When you say vomiting all the time,
to the point where some women can't even keep food or even the littlest bit of liquid down.
Oh, holy smoke. So how then, how do you know the difference? I mean, so if you can't even keep it down, what are some of the ways, once you've perhaps diagnosed that or understood that what you have is something a little more extreme than regular nausea, what are some of the approaches to dealing with that?
There are some conventional treatments. It really depends. If it's mild nausea, usually conventionally you would treat with some antihistamine. Sometimes they add a class of drugs called anti-dopaminergics. These medicines are safe in pregnancy, but they can have side effects like constipation, which some women who are pregnant have anyway. Diarrhea, insomnia, those types of things. When it's a little bit more severe, when it's hyperemesis gravidarum, there's medicines called serotonin antagonists, and what that does is it helps to control the vomiting center of the brain.
So Dr. Kwan, what you just described was the conventional approach. Please tell me about the other way and how you treat it here at the Arizona Natural Health Center.
Sure, exactly. Let me just give you an example.
Okay.
We had a recent patient, let's call her Anna, who came into the Arizona Natural Health Center. She was about 8 weeks pregnant when she arrived here, and she was complaining of nausea of pregnancy. She ended up feeling very, very nauseous with the smell, sight, and even the thought of food made her feel very, very sick. Yeah, it was really, really horrible. She noticed that the nausea was worse somewhere between 5 and 7 p.m. in the evening. She was very chilly, even in this Arizona heat. She found that she needed to wear socks in the house to keep warm.
Oh.
She also was very, very fatigued, particularly in the afternoon, and then she would just go downhill from there. She was very emotional. She would cry at even just the littlest things, sad stories on television. And also on top of that, she also had another one of the common symptoms that pregnant women have, which is indigestion.
Okay.
So she came in and we ended up giving her a medicine called Cocculus in the 30C potency, And we asked her to take it 3 times a day. Well, when we followed up with her 2 days later, she had no nausea and no more heartburn, and she was feeling really well. And even now, 5 months into her pregnancy, she's feeling great. When the occasional symptom arises, Cocculus completely takes care of it, and she's feeling great.
So she had no vomiting, no indigestion, and no side effects. Who wouldn't want that, right? And yet here's one of my questions. So while that's natural and makes so much sense, I'm sure there's so many women out there saying, well, but you know, the conventional approach says this. Does this approach really work?
Absolutely, it works. It works beautifully for pregnant women. Like I said, there are no side effects. It's very safe, very effective, and it doesn't harm the baby.
That must be a relief to so many expectant mothers. So if someone that I know is expecting and she's maybe struggling with a little morning sickness and isn't sure what to do, what should I tell her?
It doesn't have to be that way.
Okay.
That's what you need to tell her. Tell her that there is a safe, effective approach that we can help treat her so she ends up feeling really, really great throughout her pregnancy, and we can help her along so she has a safe, healthy pregnancy.
If someone I love and really care about is suffering, I can tell them that it doesn't have to be that way. And is it as simple as just having them come see you or one of the doctors here at the Arizona Natural Health Center?
Absolutely, it's that simple.
I love this. Thank you so much for sharing that story.
You're
and I know
very welcome.
so many people can benefit from that. Dr. Kwan, I have to thank you for sitting down with us today and telling us more about morning sickness and some of what women can expect and the difference between the conventional approaches and having a more whole person approach. Thank you so much.
You're very welcome. Thank you.
Absolutely. I hope you've enjoyed our segment today on natural remedies for common and not so common conditions, especially as it pertains to Dr. Kwan's information on pregnancy and how to deal with common issues. I strongly encourage you to watch the other videos in our series so that you can learn more about how natural remedies can benefit you immediately in your life starting today. I'm Jen Kay, and on behalf of myself and the doctors at the Arizona Natural Health Center, thanks for watching. Have a great day.